Today's April 20th, and I had hoped to be on the marathon course at this point in time with the rest of the Spalding Race for Rehab team, but unfortunately, as you know, the marathon is not happening today as planned and has been postponed until the middle of September. And so I am here in Charlestown in my office working very much with a great staff in a different kind of race, and that is the race to beat the coronavirus. And I'm pleased to say that Spalding and Partners Healthcare at Home are at the forefront of a lot of efforts to address the needs associated with this pandemic. At our hospital in Cambridge, very early on, we established COVID-capable units to be able to care for people who would be coming out of our affiliated acute care hospitals but still needing fairly intense level of inpatient care. So we have 2 units opened that will have 120 bed capacity, and we've admitted over 60 patients to the unit so far. And I'm really pleased to say that we've also discharged a couple of patients already home, which is of course the goal for everyone we care for. Part of the training to have units like that is to have all of the personal protective equipment. And so we have provided all of such equipment. And frankly, we're early adopters of the surgical mask being used for all of our staff and now our patients who are inpatients in our facilities as well, to prevent the asymptomatic transmission of the virus to others. And one of the things we did early on too was to restrict visitation to all of our facilities, which was a difficult thing, very difficult for family members, loved ones to not be able to visit their family member during the course of a rehab stay. And so one of the things we've done though is to help people to connect virtually with their families and loved ones. We've used staff who we've redeployed from other areas and help in a variety of ways, including having patients be able to connect virtually with FaceTime and other Zoom and other mechanisms technologically to be in touch with their families and friends, and that really makes a big difference. And you know, we're doing a lot of virtual visits on an outpatient basis and in home care too. Interesting story about one of our home care patients, a woman in her 80s, who learned how to do FaceTime with her physical therapist in order to make sure she was doing her exercises right, and who told her therapist during one of those virtual visits how happy she was that she actually did a FaceTime visit with her son who lived in California and her grandchildren, and that her son was flabbergasted at the notion that, you know, she would be able to use FaceTime. So how did you learn how to do that, Mom? And she said, well, my physical therapist taught me how to do it. She taught me more than my exercises. And so it's things like that that are really, really pretty remarkable about all that's going on now and how our staff are working in so many different ways to support our patients and their families. And most of you have probably heard about the major initiative called Boston Hope. This is the 1,000-bed capacity at the Seaport Convention Center, a partnership with the state, the city, federal government agencies, home base, and Partners Healthcare. Spalding is very actively involved in that process. We have therapists who are working in the Boston Hope Initiative. We have physicians working there as well as advising on the care there. And we have our admitting staff working to process people through the whole admission process at the convention center. I can't tell you the number of times people say, how can I help? I want to help. And you can help, and one of the ways that many of you have already helped and that I'm hoping you will continue to do is to contribute to our emergency fund that supports our patients and our staff. We will be having our marathon team also continue to do fundraising in anticipation of that run on September 14th, and donations to our marathon team as well as directly to our emergency fund will support a lot of these needs. So I thank you for all that you've done in support of our efforts so far and all that you'll do going forward. Thank you very much. Be well, stay safe.